Um, our next presentation is actually going to be shared by two speakers. Ed Arana, many of you know, I don't believe Ed's ever spoken to this group before, but many of you know and have attended some of the seminars that he puts on. Ed is co-founder and president of the American Academy of Biological Dentistry and co-founder of the Association of Health Practitioners, and he's taught seminars throughout the United States, Mexico, Canada, Japan, and Europe. He's a practicing dentist and a contributing author to Orthopedic Gnathology with a chapter entitled The Nutrimental Foundation of Orthopedic Gnathology. He's published papers in the Journal of the ADA and the Journal of the International College of Applied Nutrition. Sharing with him this topic of mercury detoxification is going to be Dr. Drs Klinghardt. Dr. Klinghardt is an MD and PhD, received his formal schooling in Germany, and did a lot of postdoctoral training in the areas of surgery, psychiatry, orthopedic surgery, and osteopathic medicine. So I think this should be a real fun time for us to listen to their expertise and clinical observations and science on the area of mercury detoxification. So Ed Arana, Dietrich.
Thank you, Rich, and members of the Academy. We're here now where the rubber meets the road. Detoxification is the thing that's going to concern us probably for the next 10 years on the best way to do this. We're getting help from a lot of different areas, and of course it's not a new problem. It's a problem that naturopathic physicians and old-time healers had looked at it in some extent. In fact, it goes back to Hippocrates and before that, when individuals would take mineral baths in order to improve their well-being. Sometimes when we do our work as dentists, we feel like we're mining in there. We have some mine-type respirators that I wear. I wear the same one that Wayne is peddling over here. And you do have to protect yourself. When you put those things on, the paraphernalia for healing, you send a message to the patient that you're very serious about the intoxicating abilities of removing these metals. Dieter, you can go to the next one. He's conducting his own seminar over there. Anyway, if you look at the body's toxic load, anywhere that you can undo it, anywhere that you can reduce it, that's what should be done. We don't have time to get into it today, but the first area that you should look at is the bowel and have that back in better balance and better intestinal functioning. And you can use many of the things that we use here. I think chlorella will help do that, and that's one agent we're going to talk about. Pectin is another one, and you find that in algae and in funguses. Go ahead, Dieter, go to the next one. One of the things we should also concentrate on is increasing the sulfur content in the diet. And if you look at the corner up there, I think the top one, about 8,600 milligrams per 100 grams of edible portion, all the way down to where the line is. This is just to give you an idea. These contain over 1,000 milligrams per portion, and all the way down the list. So we should concentrate on bringing sulfur-containing foods into the diet so we have the wherewithal to make these things. In immunology, probably the most important thing is the diet, and it's a protein, protein nutrition. Okay, next one. we're going to go kind of rapidly through these things. One of the areas that you should look at when you first begin evaluating the patient, whether you're going to detox them or what you're going to do, is you look at the liver function. They have a list of the homeopathics there. I can't read it from here what they are, but you can either use the remedy as a complex remedy from HEAL or from BHI. This happens to be BHI, and just use it as it is, or you can take those complex remedies and get a COOF series of them and then actually either muscle test or test EAV-wise to find out which 2 or 3 or 4 remedies the individual might need, or you can just use it as a remedy off the shelf. Next one. So you look at not only the liver, but you look at the kidney. Another thing in the liver functioning that's not on there is Cardus marianus, which is a milk thistle, and it is a major hepatoprotector and detoxicant, and I think everyone should use that either in the natural form, which looks like grain of wild rice. You grind it up, put it on your cereal, put it on salad, and it doesn't taste bad at all. It's a very interesting seed. Here again, kidney remedy from BHI, our Solidago is the main component of it, and when you're using DMPS, which we'll get into in a little later, you want to make sure you have good renal function, and that's an important thing, just as Murray mentioned earlier. These are the remedies suggested by HEAL to use in revitalizing the humoral and the cellular immune system. And then I went through the book and found that for ground substance or mesenchymal reactivation, all of these other components can be used. In the cellular immune system, you might want to put echinacea compositum up there on this corner because it actually stimulates fibroblasts and phagocytes to do their work. In conjunction with that, I would say not to have the patient take any sugar into their body, because that causes the phagocytes to stop their functioning for about 5 hours. So if you're up and down on a kind of a hypoglycemic kind of diet, you don't have any immune defense system, at least in the cellular portion. Okay, next one. Well, pretty much any kind of sweetener. I think there's some exceptions for maple syrup and some honeys, and that's about it. But fructose, definitely, that's a problem too. And that's where any fruit sugar that's been modified away from the fruit. In other words, you can eat it when it's in the fruit form because it has all the enzyme and minerals for its digestion. But if you eat it when it's fragmented or juiced or some other way, now you've got an imbalance. Okay, these are just some pictures of a cell and inner portion of a cell. These came from Bruce Halstead's book on the scientific basis of detoxification, which everyone should read and get. It's an old book, but it very well illustrates the problems that we have. Now, when go on to the next one. This is some of the things that Gary talked about earlier about lipid peroxidation. I believe that this is a good cell. Those are big, the large things are globular proteins, and the little white pillow things on the surface are lipid layers, and there's another lipid layer inside. But the mercury has the ability to go into that lipid layer. It binds up with the sulfhydryl groups are pretty much on the surface of the globular proteins there, and it just wreaks damage, havoc. Next one. That's just a closer up of the membrane. Go to the next one. And this is what it looks like when it starts tearing things apart. And lipid peroxidation, you can tell if it's been going on in your body by you take a look at the liver spots. Those are lipid peroxides that are lipofuscin, I think it is. And if you see those on your hands and on your arm and on your leg or wherever, then you know that you've been peroxidizing and you don't have enough antioxidants in order to control this. Go to the next one. this just shows you the mitochondria, the energy apparatus of the cell. Most of what you see there is protein. So mercury has the ability to destroy that, okay, in sufficient concentrations. Dr. Volsky, who's a chemical engineer, he wrote a book called Bioabsorption of Heavy Metals, and he's pretty much a straight shooter. I talked to him on the telephone, and he wasn't using words like biotransformation. He was talking about toxicity and detoxification, and how they utilize the biomasses of algae and fungus and seaweed to reclaim and to neutralize toxic metals in effluents like Mr. Armstrong. Yeah, I was going to say Davis, but it was Mr. Armstrong. Go to the next one. And he sees this as a like a wave of the future. Here we come again with the word chelate. Most of you know what that is, where there's an aromatic molecule that is sequestered or captured, a metallic ion. An antidote is something that counteracts the toxic effect or toxic action of a specific foreign substance. Now here a ligand is an organic molecule that has the ability to donate an electron, and it's the ligand property of these things, the algae, the fungi, and the seaweed. There are other ligands. I think most cellulose-containing foods, like squashes and things like that, things that you don't digest, you should eat those anyway because they are ligands, and they donate electrons and will help detox your body from heavy metals. Go to the next one. This is a picture of an algae mass. Even though they're unicellular microorganism plant that chlorophyll containing, they're about 6 microns in diameter. Those black specules that you see in there happen to be chromium particles, ions. Next one. This is the structure of a cell wall of a fungus. Is very much like the cell wall of an algae. An algae has a cellulose structure that contains pectin. It also has esters and certain acids along with it. These are what are called structural polysaccharides, and they have the ability to bind onto the metal. It's an exchange of ions. The cell wall gives an ion to the metal, or gives them 2 ions, and it binds up with this material, and it exits the body through the feces excretion. There's a new treatment for osteoarthritis, and what they're using are deacylated polysaccharides. And let's see, I'm just trying to think here. Okay, show the next one. What's going on there? Well, anyway, as I said, the cell wall, the algae cell wall is similar to the fungal cell wall, but it's cellulose based versus the polysaccharides of the fungi. Let's see. It's interesting to note that in the algae cells, the uptake is enhanced by the use of uronic acids, which are acids of like urine. And here again are those people that were using urine as therapy. Were they right, and does that work? And evidently, that may be one of the mechanisms that it works. In fact, when I read this over, I knew that the Japanese and Chinese venerated certain fungi like the reishi or the Gandodermia lucidium mushroom, and it gave them long life. It was worth its weight in gold, and mainly for the property of it could take and extract heavy metals out of the body. So we added that to part of our protocol. Go to the next one. There it is. The structural components of the fungal cell wall is called chitin, and then it has another form called chitinosan, which is deacetylated chitin. And basically what it is acetyl D-glucosamine. When it forms the sulfate salt of the glucosamine, that's the same substance that you have in your ground substance. So by taking and using glucosamine, you're just imparting into the body, going into the ground substance, a substance that's normally there, and it dilutes the toxic effects, let's say, of chemicals and or metals that are there, and fungal or bacterial or viral components. Another interesting point is that you should have a pH between 3 and 4 for the most effective uptake of this glucosamine. Let's see what else. Well, there are certain metals that are taken up by fungi. There's a selectivity. He thought, Dr. Volsky thought that maybe they could eventually get it down to being specific, taking a specific metal out. There's a lot of research that needs to be done in it, but there's been an awful lot done. There are certain other demercapto chelating agents that are new, and these are good for things like uranium, plutonium, polonium, these higher element metals. Okay, go ahead. We're not going to talk about EDTA here. We're going to talk basically about the water-soluble analogs of anti-leucite or demercaptol. Most people are shying away from using that, even though it's still used, because most people, half the people that take it get sick. But the new water-soluble analogs like Dimevol or DMPS and DMSA, which in this country is called Kemet, when you use those are considerably less toxic, and they do the job. Let's see. Penicillamine is the element of choice in Wilson's disease, and it also removes lead, mercury, and iron. Go ahead. DMPS can be used. Dr. Poshing is coming tomorrow. Maybe? Okay. This is what he said, that DMPS can be used as to increase the urinary excretion of mercury, and thus increase the significance and reliability of this measure. Well, we're always looking for a measure to prove that what we're doing is right. And he says especially in cases of micromercurialism, and that's basically what we got, is long-term exposure and small amounts. As I said, the two agents we're going to look at here, and both of them are useful. The DMPS is used as a challenge, and we have the protocol written up in a handout material that you should get it, or it's at the back of the room. In fact, we've given everybody, put everybody that's written the protocol in the back of that, so you can see, that information is there, so you can see how this thing evolves. Now, you may come up with one better, but one thing we should all do is we should all start doing urine analysis. As a dentist, I want to work with a physician, but you should do that so we have some numbers to present to the people that question whether the fact that they're even intoxicated or poisoned by these materials. And if we can show there's an increase in the urinary excretion just from the initial test, we could have some numbers to say, present to them and say, well, look at here, we've done 1,000 cases and we found this, that, or the other thing, whatever we find. And all indicating that, of course, people indeed have been intoxicated. And then you couple that with their subjective symptom relief, and you have a pretty good picture that maybe you're on the right track. one of the reasons why um, one of the reasons why people sometimes don't respond to mercury detoxification or just removing amalgams. There's more than one reason, but I think the main reason is they have an inactive immune system. They have a blocked ground substance functioning. They don't have enough antioxidants to clear that. They don't have enough fluid exchange. They don't have the right osmolality. They have basically things like turned to sludge down there, and in fact, and the Germans even call it they're rigid, and they are rigid. There's some tests done, functional leukocyte test, that through one reason or another we've never been able to implement it in this country, and it shows the at least for the leukocyte how responsive or non-responsive it is to a specific known challenge, and that's a very good test, and maybe someday we'll start to use it here. Let's see. DMPS is go to the next one. DMPS is and DMSA is safer than aspirin. Here again, we use this. The Russian version of DMPS is called unithiol, and the German one is called dimavol. The indications here are from chronic and acute poisoning with mercury, vapor and metallic mercury. It's chronic poisoning with lead, and it's also suitable for removing the toxic metals, arsenic, copper, antimony, chromium, cobalt, nickel, and cadmium. See any dental metals down there? Pardon me? Yeah. Yeah. Yeah, in other words, you'll see in the in the material we handed out, that pamphlet, that I want to refer you to the instructions in the PDR for Chemet, and then, but the dimavol, you're kind of on your own. It's being sold here in the United States by College Pharmacy, and that address and phone number is in the handout material. No, it's no FDA approval, but I think if you're working with a physician and you're using it for a challenge, I don't think you're going to have a problem with that, because from what I read, the people besides Apache and all the Kemper and all these other ones, they feel it is very safe, and they welcome that to treat these people with heavy metal toxicity. And the dosages are like 10 times the amount you would use for a challenge. In other words, over a period of a week. Like if you read, go on with the next one, let's take a look at it. Yeah, I think that they're coming up here. Go to the next one, Peter. Maybe it's on the next sheet. This is the protocol here. Has a LD50 of 1,860 milligrams per kilogram body weight, whereas aspirin has LD50 of 1,000 to 1,500 milligrams per kilogram body weight. So you can give quite a bit of it and not have a problem, but I don't suggest you do that. But I think we need something to amplify and show the true body burden of at least mercury. You know, it's my contention that we should get all of the metals out of dentistry, not just mercury, but all of them, because they're all implicated in problems. Tin and gold are implicated in neuropathies. Absorption is 30% when swallowed. Let's see, supplement with zinc between chelation treatments, since DMPS and DMSA increase excretion of zinc. Okay, you should, for all of the good divalent cations, you should actually substitute for those, like calcium, magnesium, anyway, you should substitute minerals, because these things take out all of the minerals. They're not selective. Go ahead. Now let's see. I'm just looking to see if that. Of course, it's eliminated through the kidney. Russell Jaffe said that he felt that a D-penicillamine was a better agent to use, trying to get the heavy metal taken out through the kidney, because it had a tighter binding to the metal. I don't know whether that's true or not, but that's his experience. And he's doing his own thing back there on the East Coast, and I have to respect his reasoning. Go ahead. Yeah. Yes, I think it does. Do you know? Dan? No, that's right. It's just extracellular. Right? Okay. Oh yeah, how much? Yeah, but it may be the stirring up of the metal. Matt is a hatter, right? Okay. Yeah, the side effects are headache, mental taste, weakness, rash, skin eruptions, that kind of thing. It isn't grave, whatever that is. Okay. DMSA, it's supplied in 100 milligram capsules. It's used, of course, in heavy metal intoxication. It removes mercury and heavy metals. It's only approved for lead intoxication in children. So I refer you to the PDR, and McNeil Labs have an exclusive on it for 7 years. I don't know, I guess it's been going, probably this is the third year now or so. And and at about 5 times the price of the old DMSA that we got from Thorn Research. And the DMSA is less toxic than DMPS. Good. An anion is an ion carrying a negative charge, and of course we went through that earlier. A cation is a positively charged ion. And then the problem with mercury vapor, of course, is that it can cause acute and corrosive bronchitis and interstitial pneumonitis, and if not fatal, may also cause central nervous system symptoms such as tremor and increased excitability. Good. Let's see. The factors influencing the toxicity of the metals, we talked about it briefly, but basically it's the amount of valence in relationship to the radius of the ion. I imagine the smaller the ion radius and the greater the charge, the more it's toxic. In the material that I was reading over, they assumed that you knew what an ion radius was and how it affected things. So the toxic effect is the interconnection between the free metal ion and the toxicological target. And the reasons for the toxic effect, as I just mentioned, that also that they're metabolically similar, or they replace the key element that doesn't have a tight as binding as the heavy metal that's going to replace it. And the uptake of the trace elements is usually related to their potential determinant, of course, between the valence and the charge and the ionic radius. And also they have an affinity for biomolecules, like mercury has an affinity for selenium, and mercury has an affinity for sulfur. Okay. This is the heavy metal provocation test for D-penicillamine. That's in your booklet. We can go to the next one. And Okay, the algae that we're currently using is a Pyranodosia. It's a unicellular plant containing chlorophyll, and that it has a unique property of having a microstructure inside the one cell, which is composed of a cellulose and pectin, and has chemical ligands, certain acids in there, and these give up electrons to bind the metal to the algae where it's excreted. It can bind with lead, copper, zinc, mercury, cadmium, cobalt, nickel, chromium, arsenic. Is that plutonium? Yeah, plutonium, polonium. Algae can also bind with precious metals, gold, silver, platinum, indium, rhodium, and ruthenium. Another ligand is seaweed, and there's also another ligand, the white pulpy part of citrus fruits, the inside of the grapefruit. It's bioflavonoids can also chelate heavy metals. So, no, this is nature's balance. It's a big company in Japan. They got multi-million dollars in sales of algae. It's a good food. Has about 60% protein. Has a lot of nutrients. In fact, there are a lot of companies out there. I'd say there's probably at least a dozen companies selling algae or algae products fortified with royal jelly and different things for health, and they make a difference. Some of these people are really in much better shape after they started taking it than before. Yeah, blue. That's a different algae. Okay. Let's see. Okay. This is a little thing showing the protective effect against heavy metals of garlic. Now, garlic is another agent that we recommend using. On the slide on the right, those are all the unprotected ones, and the one on the right, here they put garlic in the two that have not hemolyzed. So it just shows you that one of the reasons for the protective effect of garlic, it contains many amino acids that are sulfur containing. To go to the next one. No, I left that out of there. There are many sulfur containing entities in compounds in the garlic, and that plus selenium from the garlic is protective, and it's also good for reducing your hypertension and a whole lot of other things. Now this is basically the program that we've come up with, Dieter and I and Louisa, and use a DMSA, chlorella. I can't read what that is. Oh, antioxidants, and there's several companies that make good antioxidants, but what you want to see in there are, besides the normal A, C, zinc, B6, selenium, you want to see cysteine, L-cysteine, and there are others besides that. Now, what is that? I have to stand over here. Oh yeah, and vitamin C is a critical part of this program. What you want to do is you want to establish a C flush. You want to go to bowel tolerance, and not just when the stool gets soft, but you want to go all the way to diarrhea and then cut back a little bit. And we recommend using mineral scorbates because there you can take 4 or 5 heaping teaspoons in a liter of water, and you can drink that all day, and you got about 20 grams, but you can go up from that. I mean, you can make it more concentrated. It tastes pretty much like wheat milk and magnesia, so you can make it pretty much as thick as you want it. Yeah. Yeah, it's in the handouts. And, good. No, they're buffered and they stay balanced, you know. But, I don't think you get too many magnesium ions. I don't think you get too many calcium. I guess you can, but I haven't heard any problems from it. So, what's the next one there? Oh yeah, and the key and the comprehensive minerals. Well, anyway, the comprehensive minerals are just the replacement minerals, or minerals that you would use to replace what's lost from the chelation. Let's see now. Then we also recommend the use of N-acetylcysteine. Now that breaks down into glutathione and cysteine, which is the working form of that sulfur amino acid. In fact, I think that everyone should be taking at least they're 500 milligram capsules on the N-acetylcysteine, and what we recommend 4 a day, three or 4. Okay, and everyone should be doing that along with antioxidants. It's just like health insurance, and you can prevent some of that damage that's already occurred. I can't read this from over here. Well, I don't think so. I think the candida problem, someone told me that candida has an affinity for the mercury, or for the metal ions. And you find the metal ions at the apex of the villi, in other words, villi depressions. And I guess that's a natural food for that particular fungus. Fungus have a property to absorb those things. And why it, I don't know, maybe it makes them get healthier, I don't know. Does anyone hear anything on that? Okay. Yeah. Increase the uptake. And the other is a homeopathic nosode of amalgam. You can either make your own or you can buy some. Heal sells Mercury-Free Heal, and there's another company that sells those amalgam drops. I can't remember the name of it. Then we have the we also have the fungal things, the reishi mushroom and the shiitake mushroom, and we recommend that you take about 4 of those a day. And the garlic comes maybe 6 to 12 a day. You up that, and I might as well stand up here. I can't read that small writing from over here. Oh, Cal-Amo is an acidifying agent. Let's see. Okay, I can walk around. Okay. I thought I had to speak of that. Yeah, Cal-Amo's primary acidifying agent to bring that pH down into the 3 and 4 pH range. You'll normally get there by, I think, before a meal anyway. Most people would normally have that kind of stomach pH. Okay? And carbamide powder just increases the uptake of it's like a osmolality kind of balancer. Good. Would you go to the next one? And these are some of the readings that we recommend. Here again, Stephen Levine's book is on there, and Bruce Halstead's, and Martin Walker's book, and then of course Absorption of Heavy Metals and Chronic Malignant Toxicity by Sam Queen. There are a few others. There's another book that explains amino acid detoxification procedures, and that's the Braverman and Carl Pfeiffer book, Nutrients Within. Go ahead, change the next one's up again. Okay. Did you want to introduce Dietrich, or did you want me to? Oh, you already did. Oh, let's go.
just a few words. I'm going to be as brief as I can. I got into this whole arena. I did my thesis on the autonomic nervous system, and we found, we did our research on Raynaud's disease, which is a global dysfunction of the autonomic nervous system, and found a close to 100% cure rate. That was in 1975 when we did that. Close to 100% cure rate by chelating people with heavy metal chelators, and that was when my interest got up into this arena. And later on I got interested in pain management and started a pain clinic and did all my postgraduate training in pain. And we found that the single most effective measure in chronic pain that we could do for patients was to detox them from heavy metals. That was the single most determining factor whether we would get somebody well or not. Most of you have some experience with chronic pain, and most of you know about this subconsciously, but I think nobody's ever said it that sharp. That chronic pain for me is a dysfunction of the autonomic nervous system, and dysfunction of the autonomic nervous system is primarily heavy metal toxicity. And through this I got into using the Dermaval. I got acquainted with Dr. Drs in Munich, who was the foremost expert in Europe on using the DMPS. DMPS was started in Russia in the mining industry. They were looking for an agent that helped their workers to survive a little bit longer than they did otherwise. And that's how DMPS was created. And I want to go straight from here into a few cases and then draw some conclusions from that to make it a little bit more visual for you. So Ed, would you just kind of put that first case on, Gary? Yeah, let's discuss it at the end, because I got some very clear-cut opinions about that, based on some of the observations I've made. Ed, next picture. So what I've been using is a DMPS test. We inject 1 ampoule of DMPS into the patient at question, then have the patient collect the urine for 24 hours and send it into doctor's data and see what comes back. Now, hang on, Ed, can you put it so I can read the name of the patient? No, it comes in a 5 milliliter ampoule with 250 milligrams DMPS in it. It's injected slow IV. Ed has a handout there. I got my own handout just on my experience. I treated over 300 patients with DMPS in the last couple of years and have, I feel like, a quite substantial experience with it. And I summarize it in a couple of pages, and it's Carol back there has it. I don't have enough handouts. I didn't know how big this group is going to be when I got here. So some of you may have to share it or copy it from each other. But it's a very good write-up on taking you through all the steps, but we discuss it a little later. So just a few examples. This was a patient with a polyneuropathy and cancer of the bone marrow. And this was his first test. And you see that the urine mercury excretion, I can't read it from here. Ed, would you read that? It's over the 24 hours, milligram per 24 hours. 18.4 micrograms per 24 hours. And just going to introduce you into this test. If the urine excretion is more than 1 microgram per 24 hours, all the other values of the other toxic metals that are visible in this test are too low. The true value is much higher, and I'm going to show you in the next slide, next page. So this is the patient. On this next shot, a couple of weeks later, you see the mercury level is dropped substantially after the DMPS shot. But now look what happened to the toxic metals. Now the lead comes out, cadmium comes out, I can't read anything from here, tin comes out, zirconium, and he has huge levels coming out of all the virtually toxic metals that you've ever heard of. Not visible in the first test, which means that subsequent DMPS shots get to what we call the slow pools of toxicity, the intracellular stuff, the stuff that's hiding out in your body. And most dentists that have worked with me kind of get deceived when they have the first 1 or 2 shots and they have low mercury levels and think they're not toxic. The reason is they're so well adapted that the stuff in them is moved deep into the cells, and you need to keep going with the Dermaval for a couple of shots, and then suddenly it comes out. And that's where we found the chlorella is of incredible value because it mobilizes the deep pools. People, I use the chlorella now as a test. I give the patient chlorella and I ask him, tell me how much chlorella you can tolerate. If somebody comes back and says, I take 3 capsules a day and I'm sick as a dog, I know these people have tremendous pools of heavy metals. So that's become the cheapest test for me. Just to give the patient chlorella, ask him how much I can tolerate. If somebody can tolerate 10 capsules of chlorella, which is what the Japanese take on a daily basis, without getting sick, you don't have any toxic pools in you. Yeah, it's become a wonderful test for me over the last few months, and really has paid its way. Put the next thing. No, people get nauseous, they feel ill, they feel fluish, their body aches all over, they feel they can't get out of bed, they're really sick. I mean, they're in a way that they can't move. And that has become the foremost indicator for me how toxic somebody is. It correlates excellent with this test. Well, let's talk about that at the end. What's the name of the patient? Can you read it? Isabel Kalin. Isabel Kalin is a young Swiss lady who lives in Santa Fe, 17 years old. She had seizures once a day ever since she was 12 years old. Every day, 1 or 2 seizures, grand mal, with tongue bite, with peeing in her pants. A wonderful young woman. 1 shot of DMPS cured her of her illness. And if you can see her, she has tremendous levels of toxic metals coming out on the first shot. Not very high mercury, fairly low mercury. And as I said before, if the mercury drops down, that's when the other stuff comes out. Mercury seems to work like a gatekeeper. If you have high mercury levels, nothing comes out of the patient when you give them any kind of chelating agent. The moment you lower the mercury below a certain level, the other stuff starts coming out. Yeah, she's high in everything. Yeah. But it's just a very good example of somebody where the test confirms that there was a problem, but the diagnostic approach was a treatment at the same time and cured this patient. Janet Christensen, she was a patient with chronic pain. Typical chronic pain patient, everything hurt her, whiplash injury in the neck, but migraines every day, chronic neck pain, bilateral arm pain, bilateral leg pain, sciatica, low back pain. And you see her mercury excretion is 20-something or so microgram per 24 hours. I can't read it from here, but 22.4, which is very high. In my experience now, after having done over 300 cases, 22 micrograms per 24 hours, that's a very high excretion. And this is a patient who had a mercury fillings out 10 years before this. And I found if you mobilize the mercury with the DMPS, that it's been a myth that the mercury slowly leaves the body. What the mercury does after you take the fillings out, if you don't chelate the patients, the mercury gets redistributed in the body and gets layered into the deep tissues, inside the cell walls, inside the axons of nerves. It never gets out, because if I treat somebody 15 years, that was me after they had their mercury out, after I mobilize the mercury adequately with 3 or 4 shots, then I get huge levels of mercury coming out. That means the stuff has never left my body. It just got redistributed in all kinds of tissues. So this then chronic pain, just look at the lower aspect of this test. That's where the toxic metals are other than mercury. Very little. You should think, well, she got a little bit mercury, let's get the mercury out and she should be fine. Now, next picture. So this is her on the next visit. You see now the mercury level is how much somebody read it to me. 4.2, so it's dropped from 22 to 4.2 micrograms coming out in a 24-hour period. But now you start looking at the lower level. Now we start seeing perking up the other heavy metals starting to come out now. Next one. Now the mercury level on the 3rd visit is 1 point something, and now we see also that the levels of other heavy metals have substantially dropped down. At this time she was clinically cured. This was a patient I treated for 5 years with nerve blocks, with prolotherapy, with cryorhizotomies, with everything I threw at her that I knew. And she maybe made a 40% recovery in 5 years. With 3 shots of DMPS, she was cured of her chronic pain, but not doing any other modality in that time. About 4 to 6 weeks Dandura recommends 6 weeks. I do 4 weeks, and I have not had any problems with repetitive shots. Dandura says the likelihood of having an allergic reaction increases with repeated use. What he refers to as allergic reaction is little pimples and little skin rashes and stuff of that sort. But he has not observed one anaphylactic reaction, and he's done over 20,000 of these shots. No, 4 to 6 weeks. 4 to 6 weeks. Okay, next one. Now comes the most exciting case here, because this was a Mercury-Free dentist. Is that Chris Norton? Can you see that? Okay. Chris Norton is a Mercury-Free dentist who works across the street, and who is my dentist who's doing the mercury removal for my patients, the amalgam removal for my patients. And he complained to me, he just took the practice over from another amalgam-free dentist who was disabled because of amalgam toxicity and chronic fatigue. He sold his practice to this other young man, and about a year into it I made friends with him, and he told me that he's severely fatigued and depressed all the time and has mood swings. And I said, why don't you come over, we do an experiment, I pay for the DMPS, you pay for the lab test, and we do a little one-case study on you. So this was here on the first visit, very fatigued, wanting to give up his practice a year into it, wanting to change to do some TMJ type of work and going back to school. What's the level of mercury coming up? 27.8. So compared to the other patient that we just saw, just a little bit more than a regular patient who had the amalgams out. Not much heavy metals coming out of him. You would say, well, no big deal, you know, it can't be that. He must have Candida or Epstein-Barr or something else. So I had him come back 4 weeks later or something. You can look the date. It's about every 4 to 6 weeks. Now, what's the mercury level now? 99 on the second visit. Yeah, what we're getting to here is that we are mobilizing some mercury pools that weren't visible at the first shot. Now, this is actually his third shot. He had one blind shot in between where he didn't do the lab work that he promised me to do. I gotta go back and collect. No. Mind you, he is somebody who's been working Sam Ziv's protocol all his adult life. He's been following. Ever since he's been out of medical school, he was mercury-free. He never worked with amalgams, and he's been on continuous appropriate detox programs, high suction. He's not using a mask, or he hasn't been using a mask at the time, but he's been doing his glutathione and N-acetylcysteine and vitamin C. He's been very religiously about all those things, so he's worked all the conservative stuff at the time when I saw him. And now look here, mercury goes up, but also look at the heavy metals there. Look at the tin. Now just one word to tin. Dandura has proven that tin is, as far as the nervous system is concerned, approximately 100 times as toxic as mercury. 100 times as toxic as a mercury. And every dentist I've tested so far has shown significant tin levels, including Ed here, his wife who's assisting him, and many other people that I've tested, but not necessarily on the first shot. The tin comes out later. Yeah? The DMPS first mobilizes the zinc and the copper. So those are the first ones that show up. If you have really toxic pools with copper, your mercury is falsely low at the first shot, or the first couple of shots, until the copper comes down. Then the mercury comes out. Then when the mercury starts coming down, then all the other guys come out. So this was the second shot, was in fact the third shot on him. Now, next one. There's, I think, something missing maybe. Okay, now this is after I discovered the chlorella and had put him on chlorella for a couple of months and then retested him. And now we see, show the other one first, because it kind of stays more in order, because we always want to look at the mercury first. Yeah, is that next that next paper that you have there. So this is after a couple of months, about 3 months on the chlorella. You see his mercury level has completely come down. Next one, the other one that you just had there. No, the other one that you just had there. Yeah, that one. No, he had no treatment between that last one and this one. No DMPS, just the chlorella. And continuing his other program. And you see now, looking at the toxic metals at the bottom, that there's hardly anything coming out anymore. And, which of course is from my side, the real test, is that he's clinically cured. He has no more fatigue, no more mood swings, he feels fine when he comes home at night. Yeah? So that's one of the wonderful discoveries that we made. Now with the chlorella is a double-edged sword. If you're very toxic and you take the chlorella, now I use kinesiology as my research tool. Within a couple of days you find the kidneys are testing, people get low back pain, they feel nauseous, they feel fatigued. This is really like the kidneys are overloaded with the chlorella burdened with the heavy metals trying to get through the kidneys, and they can't get through because the kidneys are plugged up. And now DMPS is the ideal agent. One thing all the researchers agree on, that DMPS cleans the kidneys out from heavy metals. And in my little handout that I made on the DMPS test, we have about 10 very good scientific articles on that. And that's also the one patient that I showed before with a polyneuropathy who was severely ill. He had 30 EDTA chelation treatments and still had all toxicity on board that you could ever see in a patient. That means for me, if somebody has high mercury load, EDTA chelation therapy does not work. You know, because the mercury locks in the other heavy metals, and unless you get the mercury first, you don't get the other metals out. Yeah? That's a very important point I'm trying to make here for those of you who've had already your 50 sessions of EDTA chelation therapy and think you've taken care of yourself, and you haven't. You do a couple of DMPS shots and the crud will come out of you. Next slide. Now just at the end, just a couple of theoretical things. This is an electron microscopy picture from the ground system. It doesn't really matter which way you put it. What you see here is a picture of the interstitial space, the connective tissue. Down there you see a little end artery that dumps all kinds of stuff in the connective tissue. Everything yellow in here is the autonomic nervous system. Yeah? The autonomic nervous system is the only part of the nervous system that's connected fairly closely to each cell in the body. Yeah? The sensory and motor nervous system only goes to specific effector organs, but the autonomic nervous system hooks up to each cell in the body. And what happens, in my opinion, from the kinesiological studies that we did, is that the mercury and the other metals get dumped into the ground system and then get grabbed up through axonal transport into the autonomic nervous system. And I want to show that next picture. Like I said, for my thesis, we were very aware that it's the autonomic nervous system, it's the first part of you that gets significantly damaged and immobilized by the amalgam toxicity. And you see here at the end, this is a nerve cell, a model of a nerve cell. You have the cell body on the left side, then the axon, and the end plate of the nerve on the right side of the picture. And you see that little vesicle that kind of comes out there. This goes both ways. The vesicle, the nervous system continuously absorbs and samples the environment at the end plate of the nerve, and through a process of pinocytosis absorbs stuff from the immediate environment into the nerve, which then gets axonally transported. You see that it's sort of like a palmar lift in skiing, like a ski lift. Along those tubules, the stuff gets transported up into the cell body, and then the cell can respond to whatever is in the environment of the nerve and create appropriate antidotes or whatever it needs to manufacture to protect itself. Now what happens, and we heard that this morning, when mercury is sampled, mercury is dumped in the connective tissue, no one of us has any doubt of that, but axonally it gets grabbed up through pinocytosis, gets grabbed up and transported along the axon of the nerves, and mostly the autonomic nerves, because they're everywhere. And then the mercury prevents the new synthesis of the tubules that are responsible for the transport. These tubules exist only for a few minutes, if that. Yeah, they're regenerated every few seconds. These tubules are new generated, and we heard this morning that mercury impairs the formation of the tubulin, the protein that makes these tubes. So the mercury enters the nerve through axonal transport, migrates up to the nerve cell, and then when the nerve says, oh, this stuff is really not good for you, the only mechanism the nerve has to get rid of the mercury is to axonally transport it the other way out again. But now there is no more tubulin there to transport it out, so the cell continuously accumulates the mercury to a certain degree until it gets so toxic that it can't either transport any substances in or out. And the axonal transport is a very, very important system in the nerve cell. That's also how the nerve gets its nutrient. So this nerve from here on gets chronically starved of all kinds of nutrients, and the nerve gets sick. And it's the sickness of the autonomic nervous system that creates chronic pain, Raynaud's disease, virtually any disease. It has an autonomic component to it. Yeah? A chronic liver disease, chronic hepatitis is autonomic dysfunction of the liver. The liver doesn't get enough blood supply. Yeah? The small arteries that supply blood to the liver are contracted constantly from overfiring of the autonomics. So the liver doesn't get enough blood, enough antibodies, enough nutrients, and the liver stays sick. The moment you open up the autonomic nervous system, the liver becomes functional again. And now the wonderful thing that we have is with neural therapy, we can open up the cell membrane and have a different mechanism of getting nutrients into the cell and getting the mercury out of the cell. Yeah? That's our mechanism that we use by bathing the nerve cell connective tissue with local anesthetic. It opens up the ionic channels and the mercury can directly leave the cell membrane. These are just a couple of theoretical things that are very, very tremendous and that you're going to hear about a lot in 10, 20 years. But the main conclusion sort of that I like to give you is I feel every dentist in the room should do the DMPS test. That's why I took great care in making the instructions so that you can really follow it one by one in the handout and do it at least for yourself. Even though the legalities aren't quite clear, at least you can do it for yourself and do at least 3 or 4 shots once a month and just observe what comes out of you. Yeah? And the DMPS, let me talk a little bit about side effects. The only side effect that I've observed with the DMPS are side effects directly related to the heavy metals that come out of you. I recommend in the handout to get yourself one of the old homeopathic texts. They're the best descriptions of heavy metal toxicity. You can read up on copper toxicity, cadmium toxicity, tin toxicity, and read up the symptoms, and you find yourself in there. Yeah, and then you do your test, see what comes out of you. And what comes out of you, you go straight back to your text and read up the symptoms, and you find yourself in there. People usually observe that they feel better for a couple of days after their first DMPS shot, and then they feel worse again. As the slow pools are mobilized, when you get the superficial stuff out of you, now you mobilize the deep pools. A new wave of heavy metals other than mercury usually comes out of you, dumps into connective tissue, and you experience all the symptoms. Now, one other last consideration. One thing that we found is that you experience the symptoms of the stuff that's extracellular, that's in the connective tissue. Once the stuff is inside the cells, the only symptom you have is that you're slightly fatigued and you will die of cancer or some other chronic disease. But you have no immediate symptoms like pain, inflammation. These are all symptoms of heavy metals in the extracellular space. So when you give the DMPS shot, you clean up temporarily the extracellular space. You create an osmotic gradient that pulls out more heavy metals from the cells into the connective tissue, and depending on what's tucked away that comes out in the connective tissue, those are the symptoms that you're going to have while you go through this detox. It takes about 6 to 12 months in my experience to get somebody clean. Yeah? Seeing them about every 4 to 6 weeks for a shot. And also remember, and just that's for you very important to also know, you can have the cleanest blood and the cleanest connective tissue and still have a huge body burden of mercury, tin, nickel, copper inside the cells. When you start mobilizing this stuff, your connective tissue and your blood is going to look real crummy, but it's on the way out, you know. You get the same symptoms that you got when you were first mercury toxic, when they got the fillings in, and a couple of years later you got real sick because you got overloaded, and then your body adapted around it and you started functioning again. This is not because you've dumped the mercury, but because it's inside your cells now, and you're not living a full life. When you start detoxing appropriately, you go backwards to these stages of toxicity. But if you stay with it, you come out on the other end, and then everyone that I've treated, after 2 years, 3 years later, when you see them, you've took 10, 20 years off their life. The way they're looking, the way that their health is, their vitality is, their emotions are. It's a great treatment for infertility. In my experience, a significant aspect of infertility is heavy metal toxicity. I've gotten more women pregnant than any one of you here in the room by doing this procedure, even though I don't have my own children. Yeah, question? Yes. Yeah, the combination. The chlorella we only have since 6 months, and I've been completely impressed with the chlorella, what has been adding to the treatment. But the chlorella doesn't stand on its own. You have to combine it with an agent that helps the chlorella-bound heavy metals out of your body. And we know the garlic has been a real winner, and the DMPS is an absolute must if there's any kidney involvement, which is in most of you here in the room. If you do electroacupuncture or kinesiological testing, we find the kidneys testing in most everyone. And it's tremendous when you clean up the kidneys, what happens in the people. The first thing they usually say is, Doc, ever since you gave me that shock, my urine is really dark and yellow, and it was always white and clear for the last 20 years. These people are starting to dump all kinds of stuff. And you see it, their performance in life improves, and every aspect of their vitality improves. No. I personally use the kinesiology, and me and Louisa, who developed the concepts behind this, teach a course, and we have a handout on that. It's a wonderful, quick test, that saves the patient and you hundreds of thousands of dollars. It has been very precise, and we've been correlating it with our DMPS test. It is so accurate that it's almost scary, the way you can predict how much somebody can tolerate and how much they need. But for now, I recommend have them start. I usually tell them start with 4 capsules at night. Do that for a week. Usually everyone feels great for a few days, and then suddenly the symptoms come. Have them do that for a week, then add in another 2 pills if they don't have any side effects, and another 2, and keep them on 8 for about a month. And usually by the end of the month they will start going down, and then you take the chlorella off and get to the dose where they feel okay. And on that dose you keep them. The Japanese and Taiwanese do detox just entirely with the chlorella by doing it that way, but it's a rough detox. By adding in the DMPS, it makes it so smooth that the patient feels good most of the time. Garlic, garlic. I use from Metagenics the super garlic. It works tremendously, and within a few days usually. They have to keep drinking a lot. And the program that we have is what I do, that you have in the handout, and it works very well. But you have to be aware and warning the patient about the chlorella. This is not a chlorella side effect. This is a toxic reaction people get from mobilizing the deep pools of toxicity. Just one last word, the comparison. I've tried the DMSA. DMSA, in order to get effective, people get terribly sick in my experience. And I like to use DMSA at the end to get into the nervous system and clean that out. But what you do get is a redistribution phenomenon with DMSA. DMSA mobilizes a lot of mercury, but it can't get it out through the kidneys. So what it does, since it crosses the blood-brain barrier, so does the mercury that's mobilized. And often I find with kinesiology, if you give the DMSA too early, that we mobilize the mercury stores everywhere in the body, and it ends up in the nervous system, and the patient is much worse off than he was before. So the trick is to first clean out the body with the DMPS, so there's no more body burden, and the only place where the mercury is left, and the tin, really I should say tin instead of mercury, the only place where the tin is left, which is the worst of the agents, is the brain and the nervous system. And then you do just 3 days of the DMSA, and you get tremendous dumping of of the heavy metals from the nervous system. One other last work, silver doesn't get mobilized with the DMPS, and silver is very, very toxic to the nervous system as well. And for silver, the chlorella works very nice. Yeah? So it's really been these are the two sort of musketeers, the two strong agents that we have, is the chlorella and the DMPS. And I recommend, now with the legalities, I think we should try to get an IRB, internal review board together sometime, where we can use the DMPS in a safe way without legal hazards. I tried the penicillamine. People get terribly sick on it. I haven't seen the same clinical improvements that I've seen with this. I've tried, I think, every detox program that's out there. I use IV vitamin C in high doses on everyone. IV vitamin C has been much overrated in my experience. Yeah, it supposedly leads to dumping of heavy metals in the stool. I've just not seen the clinical improvements. I've seen great short-term improvements, but I've had people that had 50 IV vitamin Cs with 50 gram each. Once a week. They've been coming religiously, for a year or 2 years, and I've not seen the clinical long-lasting improvements that I've seen with this. Yeah, well, we do a lot of supporting in our office, but we do it on an individual basis so far, and it would be much more economical to group patients together in doing this now. Since I'm operating out there on the edge of of what's possible, I try to not draw too much attention to my program. And most of my patients I treat are out-of-state patients, so they're individuals that come in for their treatment and fly out. So I haven't had the opportunity to do that. But you have to, especially in the initial stages, be very close with the patient emotionally, and just have them understand that the symptoms they're experiencing are not them, but it's their toxins acting through them. Especially it's important, if you treat the wife, to tell the husband, your wife is going to emotionally express the worst side of herself that you've known. And I've had more letters from grateful husbands and grateful wives than any one of you have here, because when they're through the process, also that side completely disappears. It's like an entity that's in them. It's acting through them. It's all in our handout with exact steps and instructions, how you collect the urine, where you get the DMPS, where doctor's data is for the urine test. Yeah, it's not in Ed's handout. There's another. Carol, do you have one of the other handouts left for me? You may want to. Carol, keep one for my friend Gary here. I promise him. Gary Strong here is the reason I made this handout, because he asked me to write it for him. So I really made this for Gary. There's one mistake in the handout. DMPS is not an amino acid, it's a sulfonic acid. It's a boo-boo from my typist, but otherwise I proofreaded it. Okay, we need to stop. Thanks for your attention. See if you can pair up with someone and maybe make copies or so of the handout.